Good afternoon, everyone. Thank you so much for joining us. We're happy to have you here with us to learn more about our all-new approach to fundamentals education, Davis Advantage for Basic Nursing. So I see some of you on the call today may be using the previous edition of TREACE, or you might be using our 2-volume approach. And I also see that we have some that are brand new to F.A. Davis titles. So I wanted to first welcome you all and thank you again for joining. So this call today is really going to focus on our 1-volume Davis Advantage for Basic Nursing that just published. And we are excited today to give you an inside look at this all-new, unique, and fresh approach. So today we're going to provide you more of a background on what Davis Advantage for Basic Nursing is, why we created it for fundamentals, and how everything was built to work together. Then we're going to jump in and we're actually going to show you a walkthrough so you can see some of the features and functionalities from both the student and the instructor perspective, and also to see how easily it can be integrated into your course to meet your classroom needs. My name is Kristen Testa, and I'm on the fundamentals team here at F.A. Davis, and today I'm joined by my colleague, Julia Gillespie. So together we have a lot of important information that we want to share with you today. So to ensure that everyone on the call has the best audio quality, your line has been placed on mute. However, we definitely do want to hear from you and keep the session interactive. So at any point throughout the presentation, please feel free to share any questions or comments or feedback that you might have with us. And you can do that by using the Q&A box, which you can find in the bottom right-hand corner of your screen. So feel free to use that Q&A box to share your feedback, your questions, anything that you want to share with us. Periodically through the presentation, we'll be checking the chat box, we'll be chatting with you, responding to your questions, and then at the end, as much time allows, we will try to answer any questions that we haven't got to. However, the Q&A box and the Q&A session at the end of today's presentation is not the only way for you to get in touch with us or to submit your questions or share your feedback. At the close of the webinar, we will have a brief survey that's going to pop up. So take a minute to fill that out. The survey is a great way for you to let us know if you're interested in getting a review copy of the book or preview access to the online resources, or if you have any additional questions or however we can help support you. The survey is a great way for us to be able to follow up with you to help get you started. So before we jump in, I'd like to get some feedback from all of our attendees today. So as instructors, you're fortunate enough to be working with your students at maybe the most formative point in their nursing education in the fundamentals course. And the FUNS course is so important because it's their official introduction into the field of nursing. And it's where they learn those foundational skills and where they must begin to think critically and think like a nurse. But also within the fundamentals course, it's most likely where students who don't get it or are having trouble making those connections are going to fall behind and unfortunately often leave a program. And we know that teaching fundamentals can present many challenges for you. So before we jump into our walkthrough, we'd love to hear from you and have you share your feedback with us on, let us know what are some of your challenges that you're facing in your classroom with your students. So I'll give everyone a moment to type your responses in the Q&A box. So let us know, what are the tough situations that you're encountering in fundamentals? What are your challenges? And as they start coming through, I'll just read a few of them off to share with everybody on the call. Okay, so we have some coming in that students are not reading, trouble keeping students interested and keeping their attention, helping students get the basics, knowing what to cover and having students focus on that need-to-know information, trouble applying concepts or making the connections, application. Great. Thank you so much for sharing those challenges with us. They're very valid challenges, and they're also very common. We like to start off our webinars to ask you to submit your feedback to us because I think it helps to put things into perspective so you can be able to hear from your colleagues and to see that really you are not alone, that regardless of where your program is located throughout the country or what the size of your class might be, these are all real common challenges that everyone at one point or another is either facing or has faced. And it was these very types of challenges that we focused on addressing and to help overcome as we developed Davis Advantage for Basic Nursing. So our goal was to approach fundamentals content a whole new way. And as we built our solution from the ground up, we really considered the needs of the fundamentals course itself, as well as the importance of really building that strong foundational base. We've also considered the needs of today's students, how their learning is changing, and also for faculty. We wanted to help overcome those needs, some of the needs that you just shared with us, but also to help make teaching easier for you because we know your time is so valuable. So let me just share my screen so I can pop open into our walkthrough. Okay, so Davis Advantage for Basic Nursing focuses on a unique learning, applying, and assessing approach that really stresses active learning in each of these components. So our complete solution is comprised of 3 components. It is a brand new edition of our award-winning fundamentals textbook, Basic Nursing, along with 2 brand new resources for personalized learning and personalized quizzing, which help to deeply engage students and help them master this foundational content. So we present content in a way that's going to appeal to today's learner, interactively, in small bite-sized chunks, and making it accessible to multiple learning styles. Students are going to be able to work at their own pace, and they're going to be able to create their own learning plans based on their needs. We also encourage students to take responsibility for their own learning by giving them the tools to learn and practice content in an alternate format than the textbook. So they're going to get engaging content in an interactive format, and they're going to be able to track their progress as well as identify their strengths and weaknesses. And they're also going to have various ways to remediate and be able to really spark those connections to help lay that foundational knowledge so that when your students are coming to class, they're prepared and they're ready to participate so you can engage them with more in-depth conversations and application of concepts. So today we're going to talk about each one of these components, the learning, the applying, and the assessing, but it's important to remember that each piece is very much interrelated and works together to form a dynamic experience and a complete solution for your students. So we're going to jump in and begin by talking about the learning component, which is our textbook, Basic Nursing. So the learning component is a very crucial component in the solution because it is this textbook that really helps students to begin thinking like a nurse from the very first day that they walk into your course, and it helps them to build that foundational knowledge. So we aren't going to do a full review of the text today, but rather we're going to focus on 2 key themes that we want you to walk away with today. Teaching students how to think like a nurse and caring. So how does this textbook do these two different themes? So regarding thinking like a nurse, so we know that students need to learn to think right away, how to think critically, they need to know what they need to do as a nurse, and they need to understand how to provide the best and safest care to their patients. And our Basic Nursing textbook was designed to show them just how to do that. So you know that your students wanted to become nurses because they're caring individuals, and they want to help others, they want to make a difference, and this textbook is going to give them that foundational critical thinking skills they need so they can learn exactly what the role of the nurse is, what they should be thinking about and what they should be doing as a nurse, how they should be prioritizing the care, and how their care is going to impact the patient situation and the patient outcome. And knowing how daunting all of this can be to a new student and a new student nurse, the authors worked hard to make the content really accessible and relatable from the very beginning, so it caters to that new student nurse as well as to today's learners and how their learning is evolving. So the textbook is going to speak directly to the students. It uses an engaging style that makes the content more inviting and easier to read and also understand. And keeping it with a clear and consistent approach, it also helps to promote more efficient learning, so students are going to be able to focus on that need-to-know information in a way that's comprehensive, yet it's concise and doesn't overwhelm them with too much content. We also stress practical application throughout the text because we know that students need to make those connections and apply their knowledge to real-life situations. So in every chapter, we provide 2 case studies to help make the content more real and relevant, also to help students become connected to the various patients that they're going to meet in these case studies and to help tie that into clinical application. And through the various critical thinking and clinically based exercises, students are going to be put into the nurse's role, and they're going to be challenged to synthesize, to evaluate, and to safely practice applying what they're learning in the text to real-world situations to help them develop those core essential skills. And finally, the last thing that we're going to talk about today is caring, which we know is such an important dimension of nursing. Nurses need not only to be able to care for their patients, but they also need to know how to express that caring appropriately. They need to know how to communicate, they need to know how to empathize, but that's not something that's always intuitive or that a new student nurse knows how to do. So in the brand new edition of this textbook, we've added a brand new feature called iCare. And iCare helps to teach those soft skills, the softer side of nursing, and presents caring in a way that shows how nurses can go above and beyond for their patients to show caring. And it also models various behaviors and conversations to teach students how to express caring and also to provide compassion in the care that they're providing to their patients. So those are the 2 main takeaways that we want you to remember today, how the textbook helps to teach students how to care effectively and appropriately, and also how to teach them to think like a nurse. So if you haven't gotten a copy of Basic Nursing yet, let us know either in the chat box or at the survey at the end of the presentation, and we'd be happy to send you out a copy so you can take a look at some of these key themes that we talked about today, as well as do a more in-depth look at the different pedagogical features and content that this textbook includes. So we're going to jump in now and talk about the next component of Davis Advantage for Basic Nursing, and that is our applying component. So I'm going to pass it over to Julia, and she's going to introduce Davis Advantage and tell you a little bit more about what this online program does.
Thanks, Kristen. Hi, everyone. Good afternoon and welcome. My name's Julia. So let's go back to that idea that Kristen first talked about in the beginning of our call, that idea of a brand new student nurse and some of those challenges that you have in your classrooms right now. So think about this new nursing student. We're asking them to connect with content in a whole new way. This is so different from any other classes that they've taken, and Fundamentals is the first of many nursing courses. So we want to make sure that we are giving students a strong foundation. Learning to study for a course that's part of the nursing curriculum is so different from studying for something like a math course. So we want to help your students focus their study time by giving them specific feedback about their strengths and weaknesses. So in developing Davis Advantage, we wanted to help students successfully navigate their first nursing course by providing access to fundamental topics in a way that makes the content more approachable to them, to identify their unique needs and help them apply the knowledge that they're learning in a meaningful way. So we also wanted to provide you as the instructor with tools to identify at-risk students or at-risk topics and give you the teaching tools to help you provide focused remediation to help make your classroom that more active learning environment. So Davis Advantage is the applying portion of our solution, and it's designed to achieve all of these goals and more. including provide personalized learning and teaching plans. So let's take a closer look at how to incorporate Advantage into your course. We're going to start by taking a look at that class setup. We'll move into the student experience, and then we'll circle back to the instructor side so that you can see all of the data and analytics that you'll be receiving and how you can remediate and intervene within those topics that have been identified as weak areas. So I'm going to turn things back to Kristen to get us set up with the way your course will look.
Thanks, Julia. So we're going to start on the instructor side with class setup. So when we designed Davis Advantage for Basic Nursing, we wanted to make class setup for you as easy as possible, while at the same time allowing you to create the class that you want. So in Advantage, class setup really is a breeze. In 5 easy steps, in under 5 minutes, you can have your class set up. So we're going to walk through that process right now. So from the very beginning, when you're setting up your class, we're going to give you the option to choose the content model that best fits your course. So we know that some programs go the traditional route, while others may teach in a concept-based program. So you have the option to select the organizational framework that you want the content to be presented, either through traditional or by concept. And all of the great content, no matter which option that you select, is included in Advantage. The biggest difference here is the way that the topics are grouped and organized. And the view that you select is the only view that your students are going to see. So for today's presentation, we're going to choose the traditional model, and then you just go down to the bottom and hit the select traditional. And then here's now where you're going to be able to really have that flexibility and that customization to create the course that best fits your needs. So in this screen right here is where you're going to be able to turn off content that you don't want your students to be exposed to. So this is one of the things that I really love about Advantage, is that you have the control to include as much or as little content that you want your students to be able to work through. So there are 46 topics that are in Advantage, and these are key areas that were identified as the most important in the fundamentals course. So as you go and you're setting up your class, all the 46 topics are going to be selected for you by default. So you can leave them all on if you'd like, and you want your students to be able to work through all of the content, or you can go through and you can hand select the topics that you want your students to work through. So you just go through and simply turn off topics that you don't want your students to be exposed to. And then as you're going through, if you wanted to take a look, you can preview each of the topics by using one of these links over here. So we're going to talk about more of the personalized learning experience when we get into the student side. But as you're going through and setting up your class, you have the option to preview what that student experience is going to look like. So you're going to see the interactive assignments that they're going to create, and you're also able to see the types of assessment questions that we ask students before they begin an assignment and then at the end of an assignment. So as you're going through, you do have the option to preview if you maybe are on the fence, you want to see what a topic includes. But as you go through, you just select the ones you want. If you, by accident, turn one off, you just hit on back again, and it'll pop back on. So once you pick the content that you plan to teach, you just hit Save and Continue and move to the next step. So here is where you're able to reorder the content based on the order that you teach it, because we realize not every program is going to teach the content in the exact same order. So you can just, with a click of a button, drag and drop and move the content so it appears in the order that you plan on teaching it. Once you have everything set up to your liking, you hit Save and Continue, and you go to the next step. So here is where you would set start and due dates for each of the topics. So the start date is when the topic is going to appear on the student's dashboard as an assignment, and the due date is when they will need to have it completed by. So again, you have that level of control to be able to assign the start and due dates that work best for your students or work best for your program. So you can pace your students and set dates for each specific topic, so they're working on a couple topics at a time to help them manage their priorities. Or you can also group topics if you like and have them all have the same start and due date based on a point in time that you might be covering the content, or if it's like a midterm. Really, the choice is up to you. You select that based on how you plan on teaching the content. Once you've created the start and due dates that you want for each topic, you go to the last step. And really, this isn't even a step. It's just more of a summary view that gives you a nice snapshot of everything that you just did. So you can print it out and give it to your students as a syllabus so they know what to expect in the course, or you can just use it to check your work to make sure that you've set up everything you like. And really, that's it. That was under 5 minutes. We got the class set up, and now you're ready to have your students start completing their assignments. So Advantage works hand in hand with our basic nursing textbook. So we recommend that students complete their readings and their assignments in Advantage prior to class. So that way when they come to class, they've completed that foundational knowledge so that they're able to participate in your lectures. So I'm going to pass it over to Julia now, and she's going to talk a little bit more about the student experience in Davis Advantage.
Great, thanks, Kristen. So now let's take a look at the student experience. Once a student comes to Advantage and they log in, they're going to be taken to their assignments dashboard. So this lists all of my current assignments that my instructor, has assigned. They're listed in order of due dates, so I know exactly what order I should be tackling these assignments. And like Kristen said, each assignment is mapped to a chapter in the textbook. So before class, I either would have read from my printed textbook or I could read from the integrated ebook. It's right within Advantage, so I can click on that View eBook button, and this is going to take me to the specific chapter in my VitalSource ebook. I can search, highlight, add notes. There's bookmarking capabilities. I can download this so I can access my ebook offline. All of that functionality is included to make study on the go so easy for your students. So once I have read the content in the textbook, I'm ready to come into Advantage. So this class has 5 active assignments. We're going to jump into the perioperative nursing topic, and all of our navigation is so intuitive. We're just going to hit that start button to get started, and that's going to bring me over to my pre-assessment. And the pre-assessment is the key to that personalized learning experience that we have in Advantage. So each topic is going to begin the same way with that pre-assessment quiz to evaluate a student's comprehension and the retention of the content that they just read. So how a student performs on their pre-assessment is going to be that driving factor that creates their personalized learning plan, all based on an individual student's strengths and weaknesses. So each pre-assessment is going to have 5 questions, and a student is only going to take the pre-assessment once. We just want to gauge that initial level of comprehension. So the questions in the pre-assessment are given in standard formats, that's standard multiple choice question like we see on the screen. And we also have the more difficult select all that apply questions shown in our second example here. So we're giving students practice with those tough question types. So once a student completes the pre-assessment, they're getting immediate feedback on how they did using a thumbs up or thumbs down approach. So a green thumbs up is going to indicate that the student's competent in that topic, while a red thumbs down, like we see here, is going to indicate that the student needs to do some more work. So if I get the thumbs up, that green thumbs up, and I pass, I'm not required to work through the topic. I'm able to access all of the content if I'd like to review, but it's more optional for me. In this example, I did not pass the pre-assessment, so I'm going to be required to work through the topic. So let's take a look at what that learning experience is going to be like for a student. Advantage provides a very clear and consistent path to learning, so students know what to expect. For each topic, there's going to be that pre-assessment, a video, a learning activity, and a post-assessment. All of these are designed to engage multiple learning styles and to help build the context students need for understanding the content that they'll be learning in their fundamentals course. And with fun being that first course, students can also often be a bit more overwhelmed. They might not get everything that they need out of simply reading a textbook. And when they come to class a bit confused or without some of that basic information, you are really the one who has to spend more of that valuable class time going over the basics again. So what Advantage does is utilize the video and the activity within the program to spark that initial connection and lay a strong foundation for your students so that they come to class prepared to learn. So our videos are brand new. They deliver need-to-know information for key topics in a way that's designed to really connect with students. So we're presenting content in a different way to strengthen their understanding. All the videos are closed captioned and they're scripted, so if students prefer to read along or if they want to print out the copy, they're able to do so so they can review. I like to think about these videos as the way the very best teachers teach. We use analogies to tie concepts to information so that students can tie new information to what they already know to make the new content more relatable. Or we have visual representations to help make some of these key points more memorable, more sticky for students. So we've been calling these animated mini lectures because they work hand in hand with textbook content, and we've heard such positive feedback from students and instructors who are currently using these videos. It's something that students love having available to them. So once a student has watched the video, they're going to work through a learning activity that is asking them to think critically and to practice applying the content that they just learned. So activities are designed to check a student's understanding and expand their knowledge. So we have many different interactive types of videos, so case studies, bucketing activities, drag and drops, if-then scenarios with video. So in this scenario, a student is going to watch this short video and then they're going to respond to why each nursing action is taken to help them think more critically about the care that they'll be giving. So if we're looking at this question, we'll go with prevent trapping of pooled blood as our answer. When we go to check the answer, we can see that this was an incorrect answer. But the key here is that feedback, that rationale that is provided so that students understand why they answered the question incorrectly and to help build that knowledge base so that when they're asked something similar, they're going to have a better pool of knowledge to respond to and things to think about. So let's go ahead and select minimize incision pain. We're going to take this question again, and when we check the answer, we can see that the student got this answer correct, and they're also seeing that additional rationale to help them understand why they answered the question correctly. And, you know, we really feel strongly that rationales are a way to help students remediate in a variety of formats so that the content that we are conveying in this question is more likely to stick with your students. So once a student has completed the video, they've worked through the exercises, the activity, this is going to unlock that post-assessment quiz. So the post-assessment is going to give students that place to really test their mastery and comprehension after they've worked through a review of the content. Each post-assessment is going to include 5 questions, and again, once a student has completed this post-assessment, they're going to immediately see their results and how many questions they answered correctly. So here we can see that the student answered 5 out of 5 questions correctly, and those results are going to feed right into their personalized learning plan. So the personalized learning plan is going to show all of a student's work and progress through the assignment. So it's tracking everything that I have done in this program. It's individualized for each student, so each student's PLP is going to look a little bit different. So as a student, I'm easily able to see my areas of strength and weakness. So as a reminder, that green thumbs up indicates my competency areas, and a red thumbs down is going to signal where I need to do a little bit more work. So let's go back to that perioperative example that we just worked through. I didn't pass the pre-assessment, so that means that I was required to work through the video, complete the activity, and then you can see that I passed that post-assessment. If we go down to the urinary elimination, similar scenario. I did not pass the pre-assessment, so I had to work through the video, the activity, and you can see when I got to that post-assessment, I had to take it 2 times to actually pass the post-assessment, and you can see that with that 2x. Going down to bowel elimination, I had a good handle on this topic. I passed the pre-assessment, but you know, I had exam coming up on that topic, so I wanted to do a little additional review. So I opted to work through the video, the activity, and I passed that pre-assessment. So the content's still available for me to do that additional practice. Going down a little bit further, we can see acid-base downs. I passed the pre-assessment, but I haven't done any additional work in the program, but it's available if I choose to. Going down to oxygenation, I didn't pass the pre-assessment, so I'm required to work through the topic. I watched the video, but that's as far as I've gotten so far. So I still need to do the activity and the post-assessment to close out that specific topic. So the path for students within Advantage is very clear and consistent. Each assignment is set up the same way so students know exactly what to expect and they can track all of their progress easily in the PLP. So all of that individual class data is going to feed into a dashboard for you so that you're able to easily monitor and evaluate the class performance as a whole. So I'm going to turn things back over to Kristen to take a look at the analytics available to you.
Thanks, Julia. So jumping back into the instructor side, all of the classes that you set up can be viewed from your class's dashboard, and you just select which class that you want to go into by clicking the View button. And then that's going to bring you to your class overview screen. So as your students are working through their assignments, all of the class data, both at the class level and individually, all of their thumbs up and thumbs down results is going to be populated into this overview screen. So you're going to have multiple levels in this class overview screen. From at a glance, you're able to see high level all of the topics that you've assigned to your students, and they go down for each one. And then you're going to get nice at a glance metrics for each of the topics. So you're going to see your class participation. So of your students in your class, how many of them have started the topic. Then you're going to see completed, how many of them have actually gone through and completed. And then you're going to see the average time spent. So on average, how long is it taking them to complete an assignment? Then you're also going to get the aggregate results of your students' pre- and post-assessment results. So you're getting that for each topic at a high level that's going to give you your class as a whole. But then you can also drill down to see your individual student performance. So in any of the topics that you want to take a look at, you just click that View Details button, and it's going to slide a screen down that's going to give you your individual students' results. So here's really where you're able to see which students are struggling, which ones are doing really well as their progress of how they're working through the topics, when they completed them, and how long it's taking them individually to complete each of the topics. And it's nice to be able to have this information available to you because if you have a student that is telling you that they're struggling, they're not getting it, take a look at their time spent. So if they are working through the topic, like Frank Davis, he completed it in 4 minutes. This could be an indication that, your student is just clicking through, they're going through the motions, and they're just trying to get the work done with little effort. However, if you see a student that is spending a considerable amount of time in the topic and they're just still having some trouble, this could be a true weak area for them. So if you do have a student that's coming to you that does need additional practice, you are able to pull up their results of how they performed on the pre- and post-assessment. So you could work through it with them, whether it's after class or in office hours, so you can see how they performed on the pre-assessment as well as the post-assessment. And you can work through each of these questions with them to help gauge, where they're having that difficulty and help to improve their understanding. So going back to the class as a whole, as we were, developing Davis Advantage, we talked to a lot of instructors, and one of the things that we often heard was that they would be in class, standing in front of their students, and they would ask, where do you have questions, or what are you struggling with, what can I help with? And no students would raise their hand, they wouldn't receive any feedback, and they didn't necessarily know what they needed more help in. And really it's completely understandable for especially fundamental students. It's their first course. They might not know what they don't know. So here's where Davis Advantage is going to help you. It's going to do that work for you, and it's going to take the guesswork out because it's going to analyze your students' performance and give you actionable analytics so you're able to plan your class time accordingly based on your students' performance. So you're going to know all of your students' strengths, their weaknesses, and how they're performing in each of the topics before they walk into your class. And having this data available is going to allow you to intervene when necessary and help to focus your teaching so you can dedicate more time and attention to true weak areas, or you can build upon additional topic areas that you want to deepen understanding and help students make those further connections. So just looking at your class overview for some of the topics. So for urinary elimination, as a class, your students, they failed the pre-assessment, but after working through Advantage, so they completed the video, they worked through the learning activity, you can see that your students now are passing that post-assessment. So this could have been an area that could have been a weakness, but after working through Advantage, your students are understanding, their comprehension has improved. So this topic is looking good for your class comprehension. And bowel elimination as an example, this is an area your students did really well in. So as a class, they passed that pre-assessment, but some of them still chose to complete the post-assessment, although they weren't required to, and they also passed that post-assessment. So this could be an indication of maybe something prior knowledge from a previous course, or just a topic that they had very easily understood. So this could be something that you don't necessarily need to spend a lot of time on in class because your students seem to be getting it. But going back to our perioperative example that we've been using today as our case study, for your students, they did not do well on the pre-assessment, they did not pass, and even after working through the topic, they're still having problems in the they weren't able to pass the post-assessment, and they're still showing that they're having problems and difficulty grasping that this key concept. So Advantage is highlighting that this is a problem area that your class needs more attention. So it's recommending that it be added to your teaching plan and covered in your class for further remediation. And we provide you with a remediation tool with our personalized teaching plans. So let's take a look at what the personalized teaching plans are. So for each of the 46 topics, there is a corresponding personalized teaching plan. And each of these plans includes in-class activities that allow you to gear your learning to help your students' weaknesses, or they allow you to create an active classroom, as well as create more meaningful discussions and exploration of content. So the personalized teaching plans are really different than traditional lecture materials because they are designed for an active classroom and to help students become engaged so that they are discussing and sharing improving their collaboration and their participation in your class to help tie everything together to strengthen that understanding. So let's take a look at what a personalized teaching plan includes. And you can simply pull up any of those teaching plans by clicking on the View PDF button. So upon doing that, it's going to open your PDF of the teaching plan. So these plans are designed to get your students more deeply connected with the content, and they include a lot of various types of activities like case studies and small group work. There's also a lot of visual and drawing exercises, really catering to multiple learning styles. And they're also ready for you to use. They're turnkey. We provide everything that you need to use them in class. So you're going to get directions. So for each personalized teaching plan, there will be 3 included activities. And for each of those activities, you are going to receive directions. You're going to receive the answers for that activity, any tips, any helpful tips to help facilitate in doing that activity. You're also going to get goals, like what is the purpose and what should you achieve in this activity. If there's handouts that are required for the activity, we include those as well. Really, we want we wanted to provide everything you need. So to help you save time, so you're spending less time preparing, and that you are spending more time helping your students remediate, helping to make learning more fun, so they really are making those connections. So again, you have 3 activities to choose from in each personalized teaching plan. It's up to you on how many you want to do in your class based on your students' needs. You can pick 1, you can pick all 3. It's your choice, but they're available for you to use. So at this point, we've covered the learning component, which is their textbook. We've also talked through Davis Advantage and the personalized learning experience that students are going to receive, as well as the remediation tools that we provide instructors for active learning. So now we're going to move into the final piece of our solution, and that is our assessing component. So I'm going to pass it back to Julia, and she's going to introduce Davis Edge and talk about the final component in our solution.
Great, thanks, Kristen. So Davis Edge is the final piece of our fundamental solution, and it assesses the comprehension and retention through quizzing to help students master course content, to prepare them for the classroom exams, the NCLEX. It's that introduction into those NCLEX-style questions that is so necessary for fundamental students. We want to make sure that we're setting them up to do well in this course, throughout their nursing education, and then ultimately on the NCLEX. So getting them familiar with those NCLEX-style questions and alternate format questions from the very beginning. Now, I'm sure that many of you are familiar with Q&A products and have used or are currently using some of them in your courses. So let me tell you the 2 things that set our questions apart from some of the other products that are available. First are our questions. Our questions are written at a high quality level, and they're designed, especially in this program, to really introduce students to how they should be approaching NCLEX-style questions and develop those critical thinking skills that are so necessary. Second would be our rationales. Rationales are a huge part of what makes taking questions so beneficial to students. We give comprehensive rationales for correct and incorrect answers so that students understand why they're answering questions correctly or incorrectly, and then are developing that background information so that they're truly being remediated on the topic at hand. In addition, we also provide you as the instructor with the tools you need to help you continuously take the pulse of your students' performance. We want to make sure that you're getting that real-time information so that you can monitor your students' comprehension, how well they're understanding the content, their participation, are they keeping up with what you're covering in class, are they paying attention, are they engaged, and their test-taking skills. Are they getting prepared and adapting to those NCLEX-style questions? So let's jump in and take a look at the instructor side of things. So I'm going to turn things over to Kristen to talk a little bit more about the tools that you have available as an instructor.
Thanks, Julia. So for the remaining walkthrough that we're going to do for Davis Edge, we're not going to get into a full walkthrough and show every single one of the features on the student and the instructor side. We're going to take a look at just some of the key features for both the instructor and the student. But if you are interested in taking a more in-depth look, let us know, and we'd be happy to set you up with a personal walkthrough so we can actually get you in to Davis Edge and you can see exactly how the quizzing assignments can be set up, as well as the analytics you're going to receive, and then the student quizzing and the feedback report with the rationales. So I'm going to just talk about some of the instructor features right now, and then I'm going to pass it back to Julia, and she's going to wrap it up with the students. So going back to Davis Edge and this quizzing component. So if you think of the reading from the textbook and those assignments in Davis Advantage as being completed prior to class, so it's the prior class learning, you can think of Davis Edge as an after-class resource to help gauge your students' comprehension after they leave your classroom. So the questions in Davis Edge are all NCLEX style, they're brand new, and they were written specifically for the new edition of the Basic Nursing textbook. So they're going to cover all the topics in the book and really make it easy for you to create quizzing assignments that target the readings from the book as well as what students are learning in Advantage and in class. So when you go and you create a quizzing assignment for your students, you have 3 different options to choose from, and I'm going to talk quickly about each one of those. So the first one is the Create Quick assignment. So for this one is where Davis Edge is going to auto-generate the content and the questions in the quiz for you. So you're just going to simply provide which topic or concept you want the quiz to be on, the amount of questions that you want the quiz to be, and then Edge is going to choose the questions for you. So that's really a simple one. If you don't have a lot of time, or if you want your students just to be taking practice quizzes, you can assign these very quickly. The next one is the Create Custom assignment. So this one's going to give you a little bit more level of customization. So here, again, you're going to select what topic or concept you want the quiz to be on, the amount of questions, and you're also going to be able to choose the type of question that you want your students to take. So you can either select all and Davis Edge will randomize them, or you can be strategic. If you want your students to focus on those select all that apply or other alternate format questions or multiple choice, you can pick and choose the types of questions that the quiz will include. And after doing that, you will get into the actual content review, so you're able to handpick the questions that will appear in the quiz. And then the final one is the preset assignments. So here is where we've done the work for you to make it easier on you for every single one of the topics in Davis Edge. We have created a 20-question quiz that is ready to go that you can assign to your students, so really requiring no work on your part. However, if you want to customize a little bit or preview it, you do have that option, and you are able to remove and replace questions if you'd like. But really, those are the three main ways that you can get started to get your students to do additional practice quizzing. The next thing I want to quickly talk about is the analytics that you're going to receive. So as you're going through and you're creating those assignments for your students, you have a great dashboard with nice at-a-glance analytics to see how your students are performing. So you know exactly how they're doing, you can intervene when you want, and you really don't have to wait till after a first exam to see where your students are having, potential issues or their weak areas. So you're going to have at-a-glance data that's going to provide similar metrics that you saw in Advantage. So the average assignment score, the average time it's taking them to complete an assignment, and what their is the average participation. You also have access to a gradebook, so you're able to take a look at each of your students individually to see how they're performing and scoring on each of the quizzes. And one of the nice features that we have added into Davis Edge is this button right here, At-Risk Students. So with a click of a button, you are able to very easily pull up your students that fall below a specific threshold that you've selected. So really, those are the main features that we wanted to touch upon today. On the instructor side, I'm going to pass it back to Julia, and she's going to talk a little bit about the student experience.
Great, thanks, Kristen. So as a student, when I come to Davis Edge, I also have my own Success Center. So this is going to help me track my progress, show me my strengths and weaknesses, and this is where I'm going to go to see what assignments I have pending for my instructor. So there is, we call out what specific assignments I have waiting for me at the top of the page. This is also an area that I can go to create my own practice quizzes. So if I am preparing for an exam or if I want to study a little bit more on my own, I'm easily able to create a practice quiz at the topic level that I'm interested in. I can create a quick 5-question quiz if I'm waiting for the train, take it on my phone, just to keep myself fresh. So students have both of those options when they come into the program, taking the assignments you created and then also creating their own practice quizzes. So I talked about one of the strengths of our program being our high-quality questions. So let's jump in and take a look at some of the questions that are included in Davis Edge. So we have those standard multiple-choice questions, and we also have those more difficult select all that applies and various other alternate format questions. And we really take it seriously that we're helping students prepare for the exams that they're going to be seeing throughout nursing school and on the NCLEX. We want to help them build that good foundation, that comfort level of seeing an NCLEX-style question and knowing how to approach it, regardless of what type of format it's in. So over 20% of the questions in Davis Edge are alternate format questions. We know they're the toughest questions for you to write and for students to take, so we want to help do some of that work for you and also get your students feeling comfortable with those difficult type questions. So once a student has completed a quiz or completed an assignment, we give them very comprehensive feedback. So let's take a look at the way the feedback appears to students. They'll be able to see what is the correct answer and what's the answer that they selected, and they're also going to be getting those comprehensive rationales that I talked about earlier. We feel strongly that even if a student has answered the question correctly, they should read through all of the rationale options so that they can think critically about the content in the question and so that they really understand why they answered that question correctly or incorrectly. So that way, if they get a similar question in the future, they have all of the information that they need to successfully answer the question again. So that is a quick view of how Davis Edge functions. Again, like Kristen said, if you're looking for any additional information, if you want to test drive the product on your own, we're more than happy to set you up with access. That's something that you can ask in the chat function now or in the survey at the end. So one other item that I'd like to give a quick mention is EHR Tutor. FA Davis is so excited that we're partnering with EHR Tutor to bring that documentation level into your classroom. So many of you are using an EHR in your sim lab, and your students might get some practice with one at their clinical site, but we have also brought in an option for you to begin introducing documentation to your students right in the classroom, right from the fundamentals level. So Kristen had talked about all of those great case studies that we include in basic nursing. All of those patients are also included in EHR Tutor, so that as you're going through the related content in the text and in your class, you're able to call up that patient's chart in EHR Tutor, walk through their chart. There's activities in there already for your students that you can assign to really make that patient a bit more relatable, to bring some context to those classroom discussions, and to virtually visit some of those patients in a hospital setting. So if anyone would like any further information on EHR Tutor, the way our products work together, or if you'd like to see a further demo, please let us know, and we're happy to schedule that for you. So I'm going to turn things back to Kristen to close us out today.
Thanks, Julia. So I was just looking through. It seems that all the questions that have been asked throughout have been answered. We don't have any new questions that have come through, so I am going to close out the webinar for today. I just wanted to thank you all for taking the time out of your schedules to join us this afternoon to learn more about Davis Advantage for basic nursing. We know that a lot goes into changing a textbook, and adopting a new digital resource can seem very overwhelming, but we are here to help, and we want to make the transition as easy as possible. We have a great team of trainers that are available that, should you decide to adopt Davis Advantage, they'll help you with any questions that you have. They'll help you get oriented very quickly so you're able to use it in your class very seamlessly. And really, we want your experience to mirror that of our other Advantage products in MedSurg and Patho. The feedback that we've received from instructors is that it's so easy to use, it's flexible, it meets their unique needs, and knowing that you have that support available if you have any questions or if you need additional training. So with that, I will end our presentation today. Again, momentarily, we will have the survey that's going to pop up. So if you think of any questions between now and when the survey pops up, or if you are interested in getting a copy of the textbook along with access to preview Advantage and Edge, let us know. We'd be happy to get you set up. You can also email us at any time at funds@fadavis.com. We're happy to answer any additional questions that may come through as you're reviewing, or that maybe you might think of after the webinar closes. So thank you again. We hope you seriously consider adopting Davis Advantage Basic Nursing for your program. Enjoy your rest of your day.